I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, lights, camera, action, I'm ready to go. I'm never gonna give up, fall down.
You're listening to the Tom Ficklin Show on WNHHLP 103.5 FM, your home for community radio.
Good morning, everyone, and good morning to my guest, Dr. Dalai, Director of Community Services Administration for the City of New Haven, and Stacy Hutcherson, Director of Public Health Nursing for the City of New Haven. And Stacy and Dr. Dalai I was just mentioning before we went on air that we're going to talk about update for COVID crisis and contamination, inflammation, information, miscegenation. I mean, just all these words about how the society is interacting in the past and how we need to interact in the future to kind of preserve the health and I would dare say sanity of all of us. That's really kind of the overarching focus of all of my shows for the last 5 or 6 years. How do we kind of, not necessarily save the whales, but let's save the whales. And oh, by the way, let's save ourselves at the same time. But what does that mean? But collaboration and cohesion and just working together and integration of services and integration of our spirit, mind, and soul, certainly something that's continues to be a challenge. And I'm not going to put that burden on Stacy and Dr. Dalai to kind of solve those issues in the next 45 or 50 minutes. But we are going to drill down in terms of really a worldwide global crisis. This is not just a local issue. This is a global war as far as I'm concerned in terms of the COVID and SARS and what might be in the future. So that's enough of my polemics. I have a chance to be the polemics every Monday and Friday. So I'm going to give my guests a chance to kind of exercise their mouths as well. Dr. Dalai and Stacy, we're going to chat about COVID. We're going to talk about free mask distributions and mask enforcement. We're going to talk about pop-up clinics. We're going to talk about the doses, first, second, third, and who knows, the fourth, fifth, sixth, whatever doses we need, whatever we need to dose ourselves, to medicate ourselves, to immunize ourselves, I would say it's there, frankly, to love ourselves, whatever we need to do to love ourselves in so many ways, that's what we need to do. Halloween is coming up. What does that mean in terms of safety? Ages 5 to 11 in terms of their COVID vaccine status, flu clinics, and the list goes on. Dr. Dalai, kick us off in terms of an update of COVID-19. And as I say, it's Friday, October 22nd at 11:06. And if we had called tomorrow, the Zoom call tomorrow, you'd give us potentially even an additional update or iteration. So kick us off in general about the updates of COVID-19 in terms of vaccination rates and coverage, and Stacy kind of chip in as well. And again, we have 53 minutes now given my polemic, so the time is skirting by. But let's kick us off in terms of the general umbrella kind of look in terms of COVID.
I'm happy to do that, Tom, and it's great to be back on the show. I appreciate everything you're doing. So let me give you a quick status update of what's going on with COVID in New and a little bit of context of what's going on in Connecticut and the states as a whole. We have in the past 7 days about 100 new COVID cases that have been reported into us. That's actually a little bit down from the previous 7 days, so that that piece is headed in the right direction. But when you look at a 2-week period, unfortunately, we're still seeing kind of our rates in the high risk category according to CDC. So our 14-day, when you look back 2 weeks, we're still up around 15 cases per 100,000. That puts us in the high transmission category according to CDC. So we're still up there. Our test positivity is 1.6%, which means of all the folks who got the COVID test in New Haven, 1.6% come back as positive. That's actually a pretty good number. I know it was a little lower last week and it's bumped up a little bit this week, but really seeing that consistently below 2% is a good thing. As I mentioned, because our case rate is 15 cases per 100,000, we are in the high transmission category, so we continue to have to take our precautions. The other piece we look at is just beyond just how much COVID is out in the community, we kind of look at how bad is it? How severe is it? A lot of folks have gotten vaccinations. Now younger folks are tending to get more cases, and they tend to not get as sick as older folks. So we also keep tabs on how many are hospitalized. This is more of a county or region-wide number because we don't see exactly who's in the hospital, who's living in New Haven. But we have 31 patients in the hospital right now with COVID-19. Let me just jump to vaccinations. I know you asked about that, then I'll stop, and Stacy, feel free to jump in. In New Haven, we're getting close to a milestone. We have 74% of those who are eligible have received their first dose. That's great news. I mean, it's a little lower than the state as a whole, but it's great news. We've made great progress here in New Haven. And almost 70%, about 68% are fully vaccinated that are eligible to receive the vaccines. We're doing great among our older population. Of those 65 and over, we have 94% have received the first dose. We need to do a little bit more with our younger folks. As you know, 12 and over are eligible. In the 12 to 24 category, we're still hovering around the low to mid 50% getting their first dose. So we need to bump that piece up a bit more before we can really achieve that herd immunity that everyone's been talking about. So I'll stop there, Tom, and Stacy, feel free to jump in, but turn it back to you.
Stacy, feel free. You may be an indentured slave, or you're a indentured servant, or your family might have been free slaves, but I'm not going to characterize your genealogy. So exert your freedom as long as we have it.
I appreciate that. Thank you for your time. I appreciate that. As Dr. Dalai said, our efforts have been tremendous in the New Haven area to try to get people vaccinated. And, working in the health department, 54 Meadow Street, we've put out so much effort to educate people about the COVID vaccination and the availability of it. The other thing that we're currently doing in the community, our community health workers are going out in the businesses and making sure they have masks accessible to them so they can stay compliant with the current mask mandates. So we have boots on the ground every day trying to make sure that people are being compliant and doing our best efforts to try to mitigate the spread of COVID. So mask mandates, proper hygiene. I think hand washing is something we still have to emphasize. And I think that probably doesn't get enough emphasis. So we're doing a lot of things in the community to try and mitigate it as much as possible. We've had pop-up clinics, well over almost 600 pop-up clinics in the New Haven area for COVID vaccinations, in partnership with Griffin Hospital and DPH. We've probably vaccinated over 6,500 people in that partnership alone. Down at the clinic ourselves, New Haven Health Department, we vaccinated over 2,200 people. So we're putting our best foot forward, and we're trying to get out the information and to the community members that are resistant.
Excellent. And Dr. Lau, and I want to stick with Stacy for a little bit, because it just occurred to me that this is your baptism to the Tom Ficklin Show, Stacy. So welcome, and hopefully you'll have to walk on some of the coals, burning sands, and some coals by 11:50. But that's the wait. So the coals are outside your door. So when you leave your door, you're gonna have to kind of walk on those coals. But we welcome you. But you're relatively new to New Haven, and so we wanted to kind of welcome you. But Director of Public Health, folks might know Maritza Bond, your super boss and superwoman. But tell us a little about, let's segue a little bit about your responsibilities as Director of Public Health Nursing. And I want you to kind of, if you can, put it into the context. We're trying to have this conversation as a sober and rational and deliberate, but we're at a crisis. Kind of emphasize how you've been involved with this health issue for a while, how this kind of impacts you, and what do we need to do? People have to understand that this is not a normal affair, but we do not want this to be normal. And people are acting as if it's going to go away. So if I haven't kind of put too many words in my
Absolutely.
Your response.
That's quite all right. My function as the Director of Public Health Nursing, it falls under various responsibilities. Primarily, we're responsible for the health of the community. And to that end, we also provide nursing staff in the New Haven public school system. So we're out in the New Haven public school systems, and we're making sure that those mandates for masking and hand washing and social distancing is being maintained. In addition to that, we are tracking any COVID cases that come up in any of our schools. In addition to that, not just COVID alone, but like I said, the overall health of the community is important to us. So you mentioned earlier flu. We're doing flu vaccination clinics. We're going out in the community. I think what's important to me, and I think what's important to Director Bond, is that we have a presence in the New Haven community. And to that end, we've actually been going out in the community for those persons who are homebound and delivering COVID vaccinations to people who are homebound. Those are people who are elderly, or maybe they have some sort of medical issue that prohibits them from being mobile. So those efforts are tremendous, and I'm really happy that it's more like a visiting nurses service, if you will. So I'm really excited about that, and we've been able to take care of quite a number of individuals in the community. So I'm really excited about the contribution that my nursing staff are making during this pandemic.
Excellent, excellent.
Can I just add to that?
Please.
Yeah, absolutely. I think you asked for a little bit of a angle about we're talking about this pretty in a sober way, which I think is our predilection as professionals and public health professionals. But I must say, kind of on a personal note, how much gratitude I have for Stacy and the entire public health nursing staff. I think they have long been unsung heroes in the community. When they're doing their job right, nothing happens, right? And then they don't get the dedication and the recognition that they deserve. I think public health and this pandemic has really put a light on how important this staffing and this infrastructure is. Stacy's at the coordinating a very, very critical operation. I think public health has been under attack in many other parts of the nation. I don't feel that's the case in New Haven. I think we're very supported here. But it's really important to know that this is a critical part of our infrastructure as a government and how we can protect individuals in the community.
Well, what are you guys doing to negate pulling out your hair? I mean, Stacy, you passed that threshold a few ago. But assuming that you had some hair, Stacy and Dr. Dalai, the amount that you have remaining, what are you doing each day to stop from pulling out your hair out of frustration and angst and anger about how people are not behaving according to loving one another?
Well, I tell you, you're right. I have very little hair remaining to actually pull out, but I've gotten a lot of gray hairs in my beard since I've joined the team. But nevertheless, we're going out in the community every day. I've had people close to me affected by this virus. A close friend of mine spent over 40 days in the hospital on a ventilator. So, this thing is very real. I think that for a lot of people, if it doesn't touch close to their home, they think it's business as usual, but it certainly is not. This is a real pandemic. And I have small children, and I was going to become vaccinated, number one, because I'm a frontline person. And thank you, Dr. Loud, for recognizing the public health nurses and their contribution daily. So my son just turned 12, and he will be vaccinated very soon. And I'm waiting to hear what the FDA and CDC has to say about 5 to 11-year-old age group. And it's imperative because, again, part of my responsibility is to provide nursing staff in our school system. And I'm dedicated to the well-being and health of that demographic. So to that end, every day we're in contact with our nurses, and we're trying to make sure they're going around the schools, making sure the mandates are being followed. And, we're trying to protect that sector of the population as much as we possibly can. So my hat has to go off because I can't do this without my staff.
Indeed. It takes teamwork. Absolutely.
I have a few, I've kept my hair intact, luckily, but my beard has definitely grayed a little bit more since I've taken the role. To answer your question, Tom, I think a lot of it, the frustration about people not, sort of following public health guidance and our recommendations. Part of it is, I think, coming to a little bit of understanding and compassion as well. They may not have the opportunity to have been educated. They may be in an information bubble that doesn't give them the right information. They may be in a family and social network that is facilitating these beliefs and these false beliefs about the virus and the vaccines. So one of the things that we try to do is try to hit those myths head on and try to give people factual information that they can make informed decisions about the virus and about getting the vaccine and how to protect themselves. So I think, just approaching it that way, I think keeps me sane because, looking at it another way just feels like, you might be rolling that rock up a hill over and over again. But we're making progress and the stats show it. And I think that gives me some hope and confidence that we're going to get out of this.
Excellent. So let's build upon your statement, Dr. Dalai, about making progress in the context of mask enforcement in establishments. I guess you got to use the word enforcement, but to me, it's just caring for another person. But from a policy long standpoint, I guess the word enforcement is in our vernacular. So about establishments and places of business, and I want to talk about schools also for a second. What about places of business and churches and places where people gather in terms of masks and
Yeah, so right. So we do have again, enforcement is, you're right, that's part of our vernacular, and it's something that we traditionally have done as a local government, especially through the public health department. But really, our forward approach, our best foot forward approach, is one based in education. So if there are going to be enforcement, it would be preceded by education, like this is what the rules are and this is how to comply. And it's not going to be immediate, kind of fine and putting the hammer down right away. It would be like a series of escalating interventions, a verbal warning, a written warning, and then maybe fines, But our goal from our point of view is to educate, inform, and let that be the driver of the behavior rather than the kind of the punishment side of things.
Nice.
You right away in because you're closer to it than I.
Well, Stacy, please go. But in the context of this weekend, this afternoon, places of business establishments, what should they be doing or not doing in terms of helping us get out of this crisis? That's really the general tone of my question.
Well, I would say masks is just one part of the what businesses could do. I think that's one piece of it, but there's many other things they can do. We here at New Haven, we implemented over the course of the last few weeks a vaccine mandate or a testing option. So places of business that have the capacity to do that can really promote it. We've seen great results in terms of from a public health point of view with our vaccine mandate. I think we have 100% compliance of those who, I'm not saying 100% vaccination, but 100% compliance with the policy as a large employer, which I think is really important. And we also have seen this impact of a mandate actually induce individuals to go ahead and get their vaccination, whether they've been hesitant in the past for whatever reason, they were looking for some external reason to get vaccinated. I don't have the latest count, but from last week, I remember that we had 85 individuals that had started the vaccination series upon the implementation of our citywide vaccination mandate. So that's something businesses can do as well. I know that the business the restaurant here has put forward a vaccine checking requirement to enter their establishment. I think that's very creative, and I think other states and New York City has also established similar protocols. So there's other things places of business can do beyond masking alone.
Stacy?
Yes, sir. I would just have to piggyback off what Dr. Dalai just said. I think the best way that we can mitigate this is to get vaccinated. We've eradicated so many dreadful diseases in our country by vaccines, and it works. It's proven. And I think, again, what Dr. Dalai said was there's so many myths and misconceptions behind the COVID vaccination. People are thinking, oh, will I be able to get pregnant if I take the COVID vaccination? Those are all fallacies. And again, we are out here trying to educate the public and dispel those myths, and they're rampant. It's unfortunate.
If Stacy, let's go back to the schools for a second. If a parent is listening and is curious about this issue of quarantine, or someone catches COVID in the school, be it a teacher or what's our response? What's going on with quarantines or isolation or distancing? Just help people to kind of understand that we're now into October of the school year, and the school doesn't get out until June, so we still have to wait. Paint the picture a little bit in terms of update for it.
So in our schools right now, I think we have about 130 cases. I'm not exact on that number, and that, of course, it changes week to week. Nevertheless, we are implementing, making sure that our ventilation systems are up to par. We're making sure that where we are able to open windows, we open windows. The students are socially distanced 3 feet. And then when we do have a positive case, we're doing close contacts. So those persons who are closely contacted to someone who's positive, those persons are asked to be quarantined. Now, it depends on the age. If the student is vaccinated and they're asymptomatic, meaning without any symptoms of COVID, they don't have to quarantine. That's why I'm excited about what is going to happen with the FDA and CDC for the age group 5 to 11-year-old. We want our students to be in school learning face to face. And I think it was, during the time when this initially broke out, it was upsetting to me that children were losing the opportunity to have that FaceTime with an educator. I think we did the absolute best we could. And I think it was phenomenal that we had online learning. I think we learned a tremendous about children's capability. However, for those persons who don't have mom or dad at home to be vigilant about their learning process, unfortunately, it seemed as if students may have fallen behind. I don't have the data on that, but that's just my assumption. Now, what we're doing in schools, again, we're quarantining people for anywhere from 7 to 10 days, and we'll take one block or one classroom, depending on the severity in that classroom. If it's two or more students that become positive, then we're quarantining the entire classroom. Now, we're trying to currently look at our data and trying to find out how effective our quarantine methods are. So our epidemiologists are collecting the data and trying to find out, it's anything that you implement, you want to implement it, and then you want to go back and study it and see how effective it is. So that's what we're currently doing. But those are the steps and measures that we're currently taking, is we're isolating it to classrooms. Students are taking their mask breaks outside. We're not asking that, more than 1 or 2 classes eat together. We're trying to encourage that lunch is served in the classroom so that mask downtime lessens the potential exposure.
On that note, Dr. Dalai, chat about, give us the update on the COVID vaccine for ages 5 to 11. I mean, as you mentioned, in terms of the learning curve, some people not understanding the CDC approval process and the FDA approval process will say, well, why didn't young people get it from the jump, from the initial exposure? So without going into that, but currently the age groups 5 to 11 are eligible to some degree. So share with us the update in that regard.
Yeah, absolutely. I think it was very important that the vaccines were studied appropriately in that population. I think it all took a little longer than we would all like. I have a son who's in that age group, but he also is turning 12 very shortly. So it's almost coincident with the timing of the potential for the 5 to 11 rollout. Really, where we stand now is that Pfizer, the vaccine that is going to be made available most likely to the 5 to 11-year-olds, what we pretty much anticipate it will be, is seeking the emergency use authorization. As folks remember, maybe from 8 or 10 months ago, that was the same FDA mechanism, Food and Drug Administration mechanism, by which the vaccines were initially approved. They're scheduled to meet next week on October 26th. In fact, the entire infrastructure, including all the way from the White House down, is gearing up, anticipating that this is going to be approved by the FDA as early as next week. When that happens, I know Stacy will be in the mix in figuring out how it's going to be implemented. I think luckily we have that distribution and vaccination infrastructure in place. Things will look a little bit different for this because I think the pediatricians are going to be involved more. Again, the vaccines, once they're approved, will come into the state, and the state will coordinate the distribution of those vaccines for that age group, 5 to 11. But we don't have specifics right now until we get that approval from on the 26th. Stacy may have more information on the logistics and how that might roll out. So I haven't
Sure.
that piece of it.
Well, Tom, we've already placed an order to have vaccines available, and we're currently trying to come up with some ways in implementing getting that age group vaccinated. One of the ideas that we've kind of floated, I don't know if you guys recall, but we had vans going out in the community. So we're considering sending vans out to schools, and of course, with parental authorization and consent, we can vaccinate at school locations. So once again, our adage is to be out in the community and bring it to those who want it. And we're encouraging, again, if your student is vaccinated, your child will not have to quarantine. I think that's huge, and that continues to put them in the classroom, which is very important.
Absolutely. Let's jump, if we would, to next week to Halloween, and even Halloween parties have started already. And here we have another episode in community traditional event that involves really all members of the family, all age groups. So what should people be cautious about? What precautions or proactive actions can they take? When I see the kind of football games over the weekend and see the Big Ten or the 100,000 people at the stadium and nobody with the mask on, I'm trying to give you the impression that it's okie dokie. So, but in terms of Halloween upcoming, what kind of advice, suggestions, encouragement, education do you like to share with folks? Just the Halloween traditional experience.
I can start that and then turn it over to Stacy. I think the good news is that trick or treating is going to be back this year. So I think a lot of folks are excited about that. I know there's other things like parties and things that we will talk about in a second, but during the trick or treating time, I think it's very important to maintain caution. So this means wearing an approved mask, either the double layer cloth mask or the surgical mask for anyone who's out there trick or treating. And maybe, things tend to get congested, so, it's one thing to be outside and not in too much in a crowd, but I would recommend for folks, especially for kids who are not yet vaccinated, that it's very important to have the proper mask on. They can do all kinds of stuff and use their typical costumes after that. But the mask that's on the costume is not going to be sufficient, even if it covers your whole face. It's got to be that mask that fits around the mouth. So that's the one piece I think that's really, really important to keep in mind. But when you're outside, I think trying to avoid that kind of congregation and crowding, especially for those who are distributing treats, try to keep them individually wrapped, separated, spread out. Do what you can to not, facilitate people all coming together in one space and trying to grab at that candy. I think in that way, I think we'll be able to have a much safer Halloween. We'll talk about parties and stuff in a second, but I know Stacy, you might have something to say about the trick-or-treating piece as well.
Sure. I think that what's important is that, if you're going to hand out treats to the goblins, I think it's important that you stay outside. I think the weather may be conducive to that. And individually wrap your treats. So if you want M&M's, Snickers, whatever, I would individually wrap them. And as someone who's going to hand out treats, you consider wearing gloves and make sure you're sanitizing your hands. And as a parent, you want to make sure your children are sanitizing their hands before they dig into their treats and afterwards. So again, masking is very important, and staying outside, not allowing people to come inside your house. I think that's probably the best way, and hand out the individual treats to the trick-or-treaters. And again, I still promote 12 and older, please get vaccinated. So that's the best way we can fight this thing.
And I'll just add for the piece with the parties, common sense, like keep it small, keep it outdoors. If you have to go indoors, maybe open up the windows. If you're in there with folks you don't normally, affiliate with outside your family group, keep your mask on if you're going indoors. I think this year we're going to continue to have to keep, parties and gatherings to a minimum, just because there's still that high transmission going out there in our community. So that's really important to keep in mind. So it's not that we're opening the floodgates and everything's normal. I think we're taking it piece by piece. Trick-or-treating seems to be it's going to be safe this year. I think people will enjoy that. I think those big parties where everyone's crammed indoors, that's going to have to wait.
And again, I just reiterate real quick. I think regardless of your vaccination status, if you're among people that you don't really always associate with, regardless of your vaccination status, you still want to remain masked to protect those other individuals.
Mhm. Excellent, excellent. In terms of education and miseducation and propaganda and just ideological belief, let's jump to the boosters. There's certainly some people say, well, why did the first one work? Why did the second one work? And everyone's not a doctor and hasn't gone to schools of public health and hasn't graduated from medical school. So there's sometimes just resistance to what the government, big brother, big sister kind of wants to impose upon us. So this way of how citizens interpret news and content is just really bewildering to me and needless to say, challenging. But chat a little bit about the booster shots. It was recommended.
Dr. Dalai, or you want me to take that?
Yeah, go ahead and take it.
Sure. Booster shots, it's not a foreign concept if you think about immunizations in general. And you want to ensure that your antibody load is high. This vaccination, along with other vaccinations that we take, periodically you have to get a booster. So this is not a real foreign concept. Right now, it's been authorized, and we're gearing up, and we're excited about it. In fact, we're actually delivering several third doses in our clinic. And again, as I said previously, we're actually doing homebound, and we're giving out those booster shots for those persons 65 and older, as well as the age group 18 to 64 who may have some sort of health history that would make them susceptible to the coronavirus. So these booster shots, it's not anything that's foreign. What I would like to say about the booster shots is that it's authorized for Pfizer, Moderna, as well as they're currently authorizing mixing doses. So if you had J&J and you get Moderna, your antibody load is set to increase tremendously. So those are all good things. I know there was a lot of conversation early on about mixing doses and so forth, but that's now been authorized. So if you receive J&J, you can now get Pfizer or you can get the Moderna. So again, booster shots, again, it's not anything that's out of the realm of what we've done historically in the medical community.
Excellent. Dr. Dalai, any comments on that regard?
Yeah, I will say that there is a potential that some of this could get confusing for folks. So it's as a public health community, we're still actually waiting for ongoing guidance on how this is going to roll out. With CDC, we are anticipating additional guidance on how exactly to execute the boosters and the strategy around that. So, it's okay that that's going to happen. I don't want that to dissuade anyone from getting their initial series or dissuade folks from getting boosters if it's recommended. It just, just by the nature of how these recommendations have come out, there is a potential for confusion, and there's different vaccines out there, and there's half doses and full doses. But I just ask for folks to just, be informed and make that right decision based on the information they received and their circumstance. Always, speaking to a primary care physician or asking a healthcare professional, I think is always a good idea, just to make sure, check you're doing it right. I can go into a little bit more of that detail, but Tom, I'd defer to you on whether that makes sense for our program here on how that booster is going to work.
I might come back to it because I think this whole education, in quote unquote education, but medical education, and I think it's life education. I've done maybe 20 or 30 shows on public health related topics, and to me, there's no other news. To me, if you turned on the news right now, CNN, NBC, if you went to BBC, if you went to Al Jazeera, if you went to Bloomberg, the only health is infecting and affecting every aspect of our society now. That is of our health. People talk about that's a supply chain issue. That's because of health and COVID, people being sick and people being laid off and other problems. So there's no other issue right now in October 22nd on Friday in 2021 in my mind than this health and then health and all of its derivatives. So I might come back to it, but I wanted to kind of jump in this regard to the flu. We had the flu season coming up, and people sometimes are saying, "Well, why I never gotten a flu shot? Now should I get a flu shot?" I must say, Dr. DeLaw and Stacy, this is a fact. Good friend has verified that he went to a flu clinic to get their flu shot, and the person that was administering the flu shot was unaware that there was a separate dose strain for people over 65. Person almost got into an argument. Customer, the client, the citizen almost got into an argument with the person that was administering the shot about the existence of this additional booster shot for people over 65, and the person that was administering was not aware. So the education factor pertains to staff, it pertains to employees, pertains to family. This is an ongoing crisis in so many ways in my mind. So let's jump to flu for a second.
I think it's important that, we educate, and that's not just the general public, but healthcare providers. We have to be on top of knowing what the trends are, and the 65 plus flu variant, flu vaccination covers 4 different variants of the flu. We do have it at our 54 Meadow Street clinic, and that's what we offer. So again, I can't stress it enough. We at the health department definitely are doing the heavy lifting in terms of trying to get the word out to the community. And so, I appreciate your venue for assisting us with that. But sounds like we need to do more educating in our general healthcare community. Dr. Dalai?
Yeah, I think you said it. I think there's a lot for healthcare professionals to stay on top of, given all the different information. There's going to be even more for them to stay on top of with all the mixing and matching and the timing of the doses. So it's going to be important that whoever's running the healthcare systems has a good system in place for training and assistance for those who are in the front line.
I was also asking to give you guys a chance to perhaps share your views, your comments, or your perspective in terms of people getting the flu shot. Is that important? I know we have some flu clinics upcoming, but the percentage of people historically that have taken it has been less than 50 to 60% at best nationwide. We want to kind of increase that number, but what about how imperative is it for folks to seriously consider getting their flu shot this season?
I think it's important. I think that last year we saw a dip in the flu because of, we were masked up. But again, as we traverse through this pandemic and these mandates, hopefully at some point will subside to some degree. We still have to protect ourselves from those general diseases and flus that we would normally do under normal, quote unquote, air quotes, circumstances. And the flu has been one that we have dealt with for decades. Our clinic is open Tuesdays, Thursdays, 9 to 5:30, and on Fridays from 9 to 2. And we have delivered. I don't have an exact number for you right now, but we've delivered a number of doses of flu doses, and I think it's something that we have to continue to fight. COVID is just the high point in the news because of it being a pandemic, but the flu is still another variant that we have to fight against.
Yeah, I would agree with that. I think it's important to note that both the flu vaccine and the COVID vaccine can be co-administered. So you don't have to, I think there's some question about whether you have to wait, can you get them at the same time? You can get them at the same time. And, some people are, especially in the 65 and over group, most of them are vaccinated, as we've seen with our stats. They may want to go in for a booster and a flu vaccine at the same time, get it done with and protect themselves. It's worth noting that before COVID came around, flu was one of the #1 causes of death in the country, especially for older individuals. It was, I know it felt normalized and you just, it's flu season, I got the flu, it was really bad. But a lot of people, depending on the year and depending on the strain, succumb to the flu on an annual basis in the United States. And we have an effective way to prevent some of those outcomes. So I think it's important for folks to take it seriously.
Let me just spend one more second on the flu and the COVID booster kind of syndrome. When you hear, and Dr. Dalai, you've seen my kind of level of interrogation in the past, and I know I might be kind of surprising you this time with some of my questions. Stacey, this is probably your new baptism to how my mind works. But when you hear people talk about, oh, I got the flu shot and my arm hurts, or I got the flu shot and I got a headache, or I can't go to work the next day, and also the COVID after effects. What would you like to say to people in terms of those possible temporary irritations after getting their shots, and whether it's a worthwhile investment of their time?
So, if I may,
Please.
if you have some sort of symptom, that means that your immune system is working. That means that your body is receiving all the antibodies that it requires to fight against the flu or the COVID. So when the COVID is not a live vaccination. So your body is learning what COVID looks like. So it's responding. So you may get a fever, but that's normal immune response. Dr. Dalai, I'll let you take it from there. But I just wanted to point that out, that just means that your body is doing what it's absolutely supposed to do.
Yeah, and the side effects from the vaccine are minimal compared to getting a severe case of either COVID or so. That has to be weighed in the decision, saying, yeah, there may be side effects. Arm soreness is probably the most common one. You could get fever, you could get chills, you get tired, but these effects are mild to moderate. It is very rare to have any kind of severe or complicating impact from the vaccine. Speaking of the COVID vaccines, I think millions, if not over a billion, certainly over a billion vaccinations have now been administered worldwide. There's an excellent tracking system for side effects in place in the United States, picked up on a few rare conditions that you can get from the vaccine, but they're very exceedingly rare. And by and large, the safety and efficacy of these vaccines has been proven through real world experience. So the side effects are there. And some folks, I think, they do have to calculate. Maybe it's good to get the shot on a day, where they don't have to work the next day or something like that. That's some calculus that individuals may have to make depending on their circumstance. But I think you have to compare the impact of the side effect versus the potential devastating impact of actually contracting the disease.
Dr. Dalai, we have about 10 more minutes or so, and I want to segue a little bit, not to use up all of that time, but maybe 5 minutes on kind of the reorganization that and the new innovate. Let me be great. The innovation and creativity that you now, well, you brought that when you took the job, but there's a new strategy that you're involved with in terms of departmental organization, strategy, new focus, just in terms of resiliency and anti-violence. But to me, it's just that's from Rodney King. Can't we all just get along? What do we need to do to enable us to get along? So talk a little bit about that, because to me, that new strategy and reorganization and the additional staff people pertains to public health top line. This is the public health focus. This is for all of us to be healthy, safe, and well, and not die early.
Yeah, absolutely. I mean, I think it's public health under a different name. I've come from a public health background, and I see this part and parcel of that same effort is to promote and protect the health of individuals, no matter their circumstance. We have a lot of people who are down on our luck in New Haven, down on their luck, and I think they're part of the system. They have to be considered part of the system and treated compassionately. Yeah, and this is not unrelated to the pandemic. Actually, part of this idea came about because the pandemic is not just a pandemic of clinical symptoms. It's a pandemic of economic symptoms, and the pandemic exposed what the vulnerabilities that many people were shouting about for many years. But the pandemic made them very clear. Issues around homelessness, issues around substance use, issues around violence and access to firearms. A lot of the typical structures that provided services for these individuals became very disrupted. We did our best in many cases to keep them intact, but in some cases it just wasn't possible given the pandemic. So the idea of the new department was partially born by observing directly the impacts of the pandemic and how difficult it was for folks who were challenged by many issues to remain integrated and on a productive pathway. This new department is called the Department of Community Resilience. It was approved by the Board of Alders a month ago, so we're moving forward with it. And it will fold in some of the work that the Community Services Administration has been doing on reentry work, our Reentry Welcome Center, which is our drop-off center for folks returning from incarceration, and others who have been involved in the justice system in the past. It folds in our Community Crisis Team Response Team work, which we are just about to launch this weekend and next week, our large town hall community engagement sessions for public input. It integrates our Office of Housing and Homelessness Services into one department. And it adds an Office of Violence Prevention to help us focus on really, getting at the root of what's causing violence in New Haven, which is, in common with many other cities in the United States, and using a evidence-based approach to do that. It also adds a community mental health initiatives coordinator and a data coordinator to help us look at all the data to make sure we're effective, we're transparent in what we're doing. And my hope is that this new department will help coordinate and de-silo a lot of the services here and really bring that focus, like a department can focus on this population and move us in a positive direction.
Excellent. And Dr. Dalai, how does the State of New Haven Health Department relate to this new department?
So we're very collaborative. So our lead epidemiologist at the health department has already been involved in the conversations about the role of data and technical assistance and the types of evidence and best practices that, from a public health standpoint, they can bring to bear on this department. So I envision it as being very collaborative, and having a department head, I think, will facilitate that collaboration, because then you have that department head to department head connection that can really help integrate some of it.
Excellent. Gentlemen, I have about we have about 5 minutes remaining, so I want to give you a chance for closing statements or whatever's on your heart, mind, and soul. And it's a shout out to your loved ones, or it could be the favorite recipe, or it could be something more substantive. But there's no. I'll give you 2 or 3 minutes of freedom. But Stacy, before I unleash the shackles, Stacy, share with us. A young person might be looking for viewing this show. Why should they get involved with nursing or public health? I'm trying to give you a way to kind of talk about your journey briefly as well. But what's inspired you to kind of to invest in this journey of public health? What should a young person be? Why should they consider such an opportunity?
Sure. I appreciate the question. For me, my journey started out in the military, and I learned early on that, my life imprint is predicated on how I serve. And I feel that, I've been fortunate, and therefore I owe. And how do I repay that? I think that looking at the healthcare inequities, I wanted to be a part of a solution to that. So I think to make the biggest imprint, and my sons, they think I'm just the best things since Snickers. But I try to mirror to my sons what you can do and what you should do in life. And I think part and parcel to that is giving back, and nursing is a fabulous way. It's one of the best career decisions I ever made. It's one of the best ways to give back. So that's essentially the long and short of why I do this, and excited about continuing to do it. And I think public health is an essential part of making an impact. I could see an individual patient on the floor every day, and I'm not belittling that in any way, shape, or form, but to impact on a larger scale, community health is tremendous, because you get to impact those health care inequities in real time.
And Dr. Dalai, just before I come to you, Stacy, just one quick follow-up. What was the attraction to kind of come to New Haven? I mean, we're blessed to have you and glad to have you. What was the attraction? Was it the pizza?
So to be quite honest with you, I was in college before I relocated here. And as a veteran of the military, Connecticut has a great program where you as a veteran can attend school on what they call tuition waivers. So that was a huge draw. And then I love the autumn foliage. So that kind of kept me in the area.
And what was the attraction to come to this particular, nice diplomatic answer, Stacy, but let me be more specific.
To come to which area? I'm sorry?
Come to New Haven for this particular job.
So again, we were in the middle of this pandemic. I came on board March 8th, and it gave me the opportunity to impact the overall health and welfare of this community. And, you know, New Haven, just as many other large cities, densely populated, disease spreads, right? And community health nurses are the impetus for impacting community health. That's how visiting nurses started eons ago. So that was the impetus for me to come, because we were in a pandemic and I wanted to make a difference.
Well, welcome. I'm glad to have you. Dr. Dalai, Harry's going to play the music in about 30 seconds or 60 seconds. So we've taken up your time, but any closing thoughts?
Oh, I'm glad to give Stacy the platform because he certainly deserves it. I would say that I think it's very important, folks, to know, to wrap all this up, is that health is important, but health is well beyond just healthcare. Health is in how we live, where we live, our housing stock. Health is about education. Health is about our community and how it's designed. I think we've learned that lesson over and over again with this pandemic. So I think when we think about health, we got to think beyond healthcare. We got to think about the community at large.
And some of the great. Thanks, guys.
Thank you.
Thank you.
Talk to you soon. Be well. Have a great weekend. Wear those masks.
Yeah. As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going. Better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. I'm never gonna give up. Fall down, I just gotta get up, yeah. Cause this is my road.